It is a simple act of humanity to save the life of a fellow human being at no cost. However, the shocking revelation of some officers at the Kenya National Blood Transfusion Service (KNBTS) being part of a cartel that sells donated blood by Kenyans to the neighboring Somalia now has opened a can of worms, exposing the rot at the National Blood Service that has left Kenyans paying thousands of shillings in a bid to get blood. Kenyans now parting with thousands of shillings a day for the very blood that was donated for free.
Ilibidi tutafute damu pesa mpaka tukapata damu tukalipia ndio akaekwa damu.
Ilibidi watu wangu watafute pesa waweze kumpatia jamaa atoe blood ili ikompensate katika ile bank.
Kitu ambayo ilinishangaza ni ati nilipia those services.
Health Cabinet Secretary Mutahi Kagwe, however, remains adamant that nobody should be billed for blood at whatever cost.
It is actually an offense. It's morally wrong, and it is, ill behavior to do that because you didn't buy it. Why would you sell it?
From the look of things, the current blood shortage now seems to have been artificially created in a bid to benefit a few rogue officials at KNBTS at the expense of Kenyans who now have to dig deeper into their pockets to access the life-saving commodity.
There's an investigation going on and we expect arrests to be made.
According to stakeholders in the health sector, the inefficiencies at KNBTS have now forced hospitals to improvise ways of how to meet the deficit, one of them being through blood donation drives, adding that they are now forced to bill patients for blood in a bid to meet the cost of ensuring the blood is fit for transfusion.
Tests that have to be done. On the basic HIV test have to be done, hepatitis tests have to be done. We have to make sure that we don't get transmission-transmitted illnesses. That is a cost. The second thing is that blood grouping of the blood has to be done. Antigen testing has to be done. So we have to blood group your blood and my blood so that you see if we are compatible. There's storage cost that comes into that unit. So at the end of it all, there's something called cost per unit. So the cost that comes in delivering that unit that has been donated to be ready for transfusion. So what usually happens is that now that cost has to be incurred by someone.
Now, a pint of blood at a public facility will cost you between 1,400 and 1,500 shillings. A pint at a private hospital, and you may have to dig even deeper, as this will cost you between 15,000 and 18,000 shillings. However, Dr. Thuranira says the deliberations to streamline operations at KNBTS to ensure availability, safety and equitable distribution of blood in the country will help address the issue of blood billing. Other proposals to help reform the service include making KNBTS an independent authority and not a department under the Ministry of Health, and also the use of technology to track the blood upon donation, storage, up to the point it is transfused for transparency purposes. Gloria Milimu, K24 Evening Edition.